We're going to talk a little bit about the history of Good Sam Gwinnett, kind of how this organization came to be, why we decided to create Access Academy. As I mentioned, our main business is primary care. So what kind of prompted us to kind of pivot and open up a school? A little bit about the coursework. We're not gonna do too much of a deep dive into that, but we'll give you an idea of what the coursework will look like as part of being a student with us. And then we're going to talk to you about why become a medical assistant. Like why should you invest this time and space in your life to become an MA, as we call it. And then we're going to talk to you about academy expectations. One of the things about Good Sam is we are very high on quality training, and we do expect anyone who joins our academy or anyone who wants to become a part of our organization to know what the expectations are. And then certainly costs, because you will want to know that, and what type of certifications come with being an MA, and then finally externship and job placement. Okay. All right. So can we pop over to the next slide? All right. So let's talk a little bit about the history of Good Sam Gwinnett. So Good Sam Gwinnett was started in 2005 by some folks from Perimeter Church, who essentially decided that they wanted to create a place for folks to come that needed access to care, that may not be insured or otherwise have access. So the first location for Access Academy was located on Club Drive. And for those of you who are familiar with Gwinnett, that is near Pleasant Hill Road. And this location was very, very small. I mean, if you were to look at how many people could fit into our building at the time, it was very, very limited in the amount of patients that could be treated. It wasn't open every day. There certainly was not a lot of room. And so Greg Lang, like I mentioned, who was my predecessor, decided that we needed more space, right? And so in 2012, with some funding through HUD, which is where we get a lot of our funding to build our buildings, we were able to open up a larger building, which is the building located on Beaufort Highway. And it became a self-pay model versus being a free model. So what you'll notice about Good Sam is that, if you've been a patient with us, or if you know of someone who's been a patient with us, our fees are very, very reasonable. They are deeply, deeply discounted compared to what most would pay out in the what we call private office setting. So, and that model allows us to sustain ourselves, right? Because as a nonprofit, the hardest thing in the world to keep is funding. So having a point of sustainability really does matter. It makes your donors a lot more involved with your work, and it makes your donors really want to support you more. So that model has really sustained us and has really led us to become about 70% sustainable. And we only have to, get donations through grants and individual donors of about 30% of our funding, which is very, very good for a nonprofit. And so through a lot of hard work of a lot of different people, we have become the largest provider of medical and dental nonprofit services in Gwinnett County, and one of the largest in the state. So we do a lot of interaction with, other clinics throughout, like there's the Georgia Charitable Clinic Network. And so we know how big other nonprofit clinics are, and we're definitely one of the biggest. And our services that we offer are medical, dental, and then also biblical counseling. So Good Sam is founded on faith, right? So our mission is to act as the hands and feet of Christ, and serve those that need to be served from a healthcare perspective. Many of our patients know that. Some of our patients don't care about that, right? We don't force that on anybody, but we do offer that as a service to our patients. If our patients want us to pray with them, if our patients want us to talk to them about the Bible, we can certainly do that. And like I said, we have some that come in and just want to be treated. But I think it's important to know that we are a faith-based ministry, and that's kind of the roots of where Good Sam kind of formed and came to be. All right. Next slide. So when we think a little bit about training, right? Like how do you go from having um, a primary care clinic to opening a school, right? Because typically what we had found in the past is that a lot of other medical assistant trainee programs wanted to use Good Sam Gwinnett as a training ground for some of their students because we had always just been so active in our community because that's been our history. So if you look at these organizations to the left here, these are all places where we have currently or have had MOU agreements, and this does not even cover all of them. I just picked um, the most prevalent ones, but certainly there are more than this that couldn't fit on the screen. But if you look at, where we have relationships, obviously Morehouse School of Medicine, University of North Georgia, Georgia Gwinnett, PCOM, Mercer, University of Georgia. What we have done is we have committed to help train the next generation of healthcare providers. So at every institution except GGC, that's all been master's level students. So we've historically trained physician assistants and nurse practitioners. They've come to our clinics to do their clinical family practice rotations. And we've done that for about a decade now. So anyone who comes and works at our clinic as a provider knows that they're going to be expected to help train. And because we believe in it. And I can just say it's not lucrative for us to train, right? We don't get paid by the student to train. It's something that we truly do because we believe that it's important and part of our mission. So a lot of healthcare providers are just not doing that anymore because, they're busy. They've got stuff going on. They may not have adequate staffing, but training is truly a part of who we are. And at any given moment, if you come to our clinics, you're going to see each medical provider with a student. So that kind of helped us formulate the idea of formalizing this into an academy, right? So we wanted to create Access Academy to serve those students who are not yet licensed, who may not be college bound, who may not have college degrees, to talk about, to create an avenue for them to kind of decide to go into medicine. And we feel like we can do that, right? Because we've done it for many, many years. And I should have put a photo in here about our Magnificent Seven. And those were students who came through GGC, some of them, and some of them came through other avenues and later became licensed physician assistants and nurse practitioners and RNs. And it's all because they started as medical assistants with us. We were able to train them and they went out and, got licensed. And so, their earning potential and just what they can give back to the medical field now started at Good Sam. So in my tenure, my brief tenure, I watched them go from MAs to licensed providers, and that was just awesome. And that is our goal, to help you become a really, really good MA, one that everybody wants in their building, or help you kind of use this as a stepping stone to pivot on to that next area of healthcare. Because what you will find is when you get into healthcare, it's not all textbook, right? Like, how do you feel about touching a patient? How do you feel about hands-on learning or hands-on or having a conversation with a patient that's volatile or difficult? So this is all stuff that we feel like our program will help prepare you for. And you can make an informed decision about whether or not medicine, healthcare is really for you. All right, so let's go to the next slide. All right, so what I kind of give you here is just a very brief overview. And certainly, if you decide to apply and are accepted into the academy, we will go into much more detail during orientation. But this is just a sample of what the program entails. You're looking at 12 weeks plus a 4-week externship. So the 12 weeks will be in person, and it's going to require in-person learning 3 days per week. So I believe the hours are 9 to 2. So what that's going to look like is from 9 a.m. to noon, you would have classroom type setting, and then you would break for lunch. And then for the rest of the afternoon, roughly around 12:30 to 2 would be labs. right? So we want every class to be instructional. We want you to have interaction with your teachers and your peers. And we purposely didn't want this to be an online program. And I know a lot of MA programs are online now, but you cannot be a medical assistant online, right? As a new medical assistant, it's very, very important that you know how to interact with patients. And typically telehealth or medical type positions online don't typically come until you have a little bit more experience, right? Until you've been out in the field, until you know basics about patient interaction. So we wanted this program to prepare you for an entry level position of what you would see, or what your provider would expect of you, as a new MA. So again, if you look at the coursework, it's already been developed. We've already had that coursework looked over by the state of Georgia, and it has been certified by the state of Georgia for us to teach. So you're going to learn fundamentals, you're going to learn law and ethics, terminology, which is really important, right? Sometimes when you are listening to people in healthcare, it sounds as though they're speaking a different language. That's because they are. There's a lot of different words and terminology that you have to use that your provider is going to expect you to know as an MA, or you will certainly hear it enough over time that it will become a different language to you that you now know. Anatomy, you're going to learn about the fundamentals of medical assistance. And we also added a module in our class about basic life and employment skills. Because again, in our experience, we have had a lot of MAs come through for externships, and they have really, really kind of fizzled out before the externship even hardly got started, or there were issues going on in their family life or personal life, and that's really, really hard to deal with. I get that, but what are some things that you can do to help mitigate that? What are some of your employers going to be looking for when they're trying to decide to hire you? Right. So we added that module to really kind of help people just know more about what a good medical practice is looking for. And not only that, but how to stay employed and retained by your office. Okay, let's go to the next slide. All right. And Shannon, I believe you were going to handle this slide.
I think so. Okay. So what is a medical assistant? Most of you would think of a medical assistant probably as checking blood pressures, getting patients in the room, getting information about what their visit for. But a well-rounded medical assistant really can run the front of the office all the way to the back. You start by just being good with administrative tasks and skills, checking patients in, greeting patients, answering phones, scheduling patients, accurately getting the patient's information from them and recording it so that the provider has the correct information, medical histories, and of course vitals, as well as setting up procedures, performing lab tests. Our medical assistants will also be trained in phlebotomy, which you could get another certification for. Shamika will get into that a little bit later, but there's so much more that you could do with this, so much to being a medical assistant. Shamika may have touched on this, and if she hasn't, I'm sure she will. Many of our providers want or are looking for those well-rounded medical assistants who anticipate issues before they actually arise, anticipate their needs, the patient's needs and the provider's needs before they actually come up. And that's just one of the things that we're going to take pride in teaching you. But a medical assistant is really going to be a very pivotal part of providing communication between all office staff, front office to back office, providers to patients. They really do play a critical role in that. Okay, can we go to the next slide? And why should you become a medical assistant? Well, there's tons of reasons. I was a medical assistant way back when, that's where I started. That's where my love of medicine started and went into a whole lot of things. I think that most people genuinely get into the medical field, no matter whether they're a medical assistant, a physician, whatever it is, a nurse, to make a difference. We tend to be people who want to help other people. And that can be in many different ways. Like I said, front office, you're helping people get their appointments, understand what's going to happen during their visit, as well as making a difference to the patient. And in what we do and the types of patients and the part of the community that we see most often, that difference is really felt. We are helping people who have nowhere else to go. So it's a wonderful thing when you have a patient come back to you later and say, you really made a difference. I'm so glad that I came here. And it's even better when your provider tells you that as a medical assistant, that you made a difference. It's an in-demand career. I can promise you, if you go in any part of the medical field, you will never be without a job. You will never be looking for a job. If you do, it will be brief. Because nurses, medical assistants, front office, everything is needed and always needed. And also, it's just a pathway to wherever you want. Like I said, I started as a medical assistant at the age of 17. I'm way older than that now. And you can do whatever you want. Shamika touched on the fact that we've had so many people that we trained as medical assistants who came to us with no medical experience, did not know a single medical term, and are now providers, are now nurse practitioners and RNs and going to medical school. It's really endless. If you want to be an administrative, you can go from medical assisting to anything you want, to management, to running a school, to running an academy, or even on to becoming a nurse or a provider, a doctor, a physician. It just is never ending. Next slide. And of course, this lends to some of what we're talking about, how in demand anything in medical is. Our communities are in need all over Georgia, all over the United States. As you can see, there's 18 counties in Georgia that have no family medicine doctor. No, they can't go get their annual physicals. They have a cold, they can't just go get a checkup. They don't have access to family medicine. Getting their diabetes medications or their blood pressure medicine is extremely difficult. 40 counties have no internal medicine physician. 65 counties have no pediatrician. 65 counties in the state of Georgia with no pediatrician, and 82 counties with no OBGYN. So women are traveling and seeking, having to go other places for those specialties. And of course, 90 counties with no psychiatric care. So we know that medical providers are needed everywhere, and that starts with medical assistants, because like I said, medical assistants are pivotal in the support of running an office, running a hospital, running nursing homes. Nurses and doctors can't do it alone. So medical assistants are very pivotal in creating that team. Next. Okay. And the expectations of Access Academy. Again, Shamika touched I'm sorry for my voice, y'all, I'm a little hoarse. Shamika touched a lot on Good Samaritan and how we pride ourselves on excellence and how we have trained people from the ground up. We've done it unofficially, and now we're going to do it officially. But we want potential MAs to go out into the working force prepared and knowing exactly what to expect at their jobs, their potential jobs. And that means that we have to set the expectations from the beginning. So of course, in the beginning, you will go through an interview, you will do your application, we'll do your income verification, the normal things you would do before any course that you're going to take. You will, before the first day of class starts, have to do a hepatitis vaccine and have a negative proof of a negative TB test. And that is because your employer is going to expect that. And because you are doing clinicals, you will be you will be performing tasks on actual patients during your externships. You will have to have these immunizations and tests done. And of course, consent to a criminal background check. During the classes, you will also be expected to wear uniforms. just as if you will once you are employed. And you will be expected to arrive to each and every class on time. Punctuality is looked upon a lot greatly in employment. So please make sure that you're going to be on time. You have to maintain a B average or 80% competency in in all of the coursework. You will have to have 100% attendance for every course, for every class. Of course, life happens. There'll be some things, sickness, illness, that will prevent some people from coming on occasion, but those have to be approved, and all of the coursework must be made up to 100%. I know that some people go, wow, everything's online these days. Why are it so strict? Again, we pride ourselves on excellence, and we know what employers are going to find important, and that it is extremely important. So we're going to set you up for success from the beginning.
Yeah, and I just want to kind of add, Evelyn, if we could go back one slide. So we really do believe that having this structure is going to be very, very important, right? We are not our primary lane is not education, right? This is something that obviously we're building. However, we do have the knowledge and expertise in the healthcare industry that we understand what makes a person successful in this role. And aside from the group that we've just mentioned, we have some medical assistants on our staff right now who are about to go to nursing school. And with the amount of experience that they have as MAs, they've been back office managers, they've been running the floor. They will go to whatever job they get or whatever are in a position that they decide to take and be rock stars, because we're a very busy clinic. And if they can run the floor on our clinic, then they will go in definitely ahead of the game. So we are going to be selective on purpose. And because we do want folks who want to really be in this program, folks who want to finish, folks who want to do well. And what this allows us to do is be selective, because we are, Good Sam and being clinicians is our primary it's our primary lane. We have decided that we want to be very selective about this program. So because we don't want, you guys to come in if it's not something that you think don't know if you want to do yet, because we do want to put out MAs that are, wanting to be MAs for at least a year, right? To go into a new environment, to just learn. And again, it's not saying that you're going to be an MA your whole career. But when we talk a little bit about externships and job placement, you have to really, think about this and make sure it's something that you want to do. I leave anything out, Shannon, or? Okay.
I don't think so.
All right. So let's pop over to the next slide. So let's talk about cost. So one of the things about this program that is going to really differentiate this from a lot of competitors is the cost. So some of you may have started looking into becoming an MA, or you may have looked at, what it costs to go to MA school or get some sort of certification in that. And a lot of those programs can start anywhere from $10,000 to $20,000, just depending. This is what people tell us, right? We've had partnerships with some schools that charge as much as $18,000 to do their program. And so if you know anything about Good Sam, we've always said our mantra is no debt. And we don't like for anyone to go into any sort of medical debt, whether that be a patient who has to pay for healthcare or a student who attends our academy. And one of the reasons why we are going to be selective in this program is because the cost of this program is subsidized by donors, right? So if you look at the cost, we're only charging each student $2,500 per student. And that's a significant decrease into what it normally costs. So this can be paid per month. So we do not want all of it at once. You can do a $500 per month payment plan. We also take Affirm. Many of you may be familiar with that. That's kind of the pay over time app that you see on a lot of checkouts. If you go to Target, Walmart, whatever, that would be totally up to you if you want to go through a firm. Our clinic does take that, and we would accept that as a form of tuition payment. However, one thing to keep in mind, if you do pay full price and you decide, a month into the program or several weeks into the program that you want to get out of the program for whatever reason, or you have a life situation, the return is prorated. So because it's a $500 a month, if you go for 2 months, you would feasibly only get back 1,500 of that, right? So you wouldn't get the whole 2,500 back. So if you do pay all at once, please keep that in mind. And that would be the same with a firm. Scholarships may be available for student portion of tuition based on need and potential. And I say may because we do have donors out there that really are supportive of this program, right? They look at it and they say, oh my gosh, I want to sponsor a student. If that's the case, if a donor comes to us and say, hey, I will pay for a deserving student to go, then that would look like us looking at the applicants that we have and look at need first and foremost, and potential. So Shannon mentioned that we do income verification. We do income verification at our clinic anyway. So I don't want you guys to think that that's something that we don't know how to do. And we look at, federal poverty level number. So just to give you an example, if you have a family unit of 4 and you're 200% of the federal poverty level, that means you have a household income of $55,000, right? So we're going to look at need. Your household income may be higher or lower than that, but we're really going to base that on who has the greatest need, and also what you put in your application. If you're thoughtful about what you put in your application, if you define your goals and what you hope to accomplish out of the program, and that funding is available, we will certainly give out. I mean, we may raise enough to give most folks scholarship. That would be great, right? If a donor came along and say, hey, I want to cover this, this, and this. But just know that that potential may be out there, and it just depends on the amount of support that we get from the community. So, and then there's a $150 to $175 books and fees, and that helps cover the cost of the textbook that we'll be using, which will be on a digital platform. And also your application fee is $50. Okay. And then we mentioned certifications. Now, let me just preface this by saying there are a ton of different certifications out there. So a lot of people may say when they apply, say, oh, well, I want to get my certification to be an MA. A school cannot certify you, right? There are national organizations and bodies that actually do the certification. We give you the skills and the training needed to take the test, but you have to actually take and pass the test to become certified, right? So if you go through Access Academy and you don't take any certification tests, then you will not be a certified MA. Now, in the state of Georgia, there is not a requirement for you to be certified to become a medical assistant. In some states there are. I believe in California, Texas, there are some states that require MAs to be certified, but not in the state of Georgia. However, it is preferred by a lot of employers. So while the knowledge is in your head, we highly recommend that you consider getting certified, and also the specialty that you decide to go into, right? So if you decide to go become an MA and you're like, listen, I really like dermatology, and that's something that's a place where I would really love to do an externship and become an MA there, then they may have certain certifications that they want you to take, right? But the most common one is the CMA. And a couple of our MAs had CMAs when they joined us. Some of them got their CMA after they got employed with us. And it's very broadly recognized. But again, if you were to type in MA certification, you would get a lot of hits on Google. But the CMA is typically the one that is most accepted. And then you have the RMA, which is that's through the American Medical Technologists Association. And for that one, you need work experience and have completed a medical assisting program. And then there's the NCMA, which, you must have completed a medical assistant program and have work experience as well. So again, a lot of the certifications do the same thing, but if you're looking at recognition, the CMA is going to be the one that's most recognized. Okay. And so let's talk a little bit about externship and job placement assistance. And so I want to be very clear in the terminology that the state allows us to use when talking about job placement. So when we were going through our certification process, one of the things that they reiterated to us is that no school can guarantee job placement, right? They have specifically asked for our trade schools and technical schools to take that out of the verbiage because, people were leaving and graduating and saying, oh, you guaranteed me a job. So they don't allow you to print that verbiage or put that verbiage out at all. What they do allow you to say is that you offer or we offer job placement assistance, right? And that is what we do plan to offer. So the externship is 4 weeks and there is a requirement of 160 hours. And we do expect for that to be as close to 4 weeks as possible, depending on where you are accepted by your externship. Of course, we have a little bit of wiggle room in the schedule in case it kind of runs over a little bit, but we really want this to mirror a work experience as closely as possible, right? You get there when the staff gets there, you eat when they eat, you really kind of get an idea of whether or not this is an environment that you want to be in. So that is the requirement. We're going to provide assistance with obtaining an externship. We have community partners who have said they want to partner with us to take externs, and we also have our own clinics where we will be training externs. A lot of it is going to depend on you and what your interest is in. And so at some point during the course of the program, we'll take a survey of, what environment do you see yourself working in? Are you more of a hospital environment, or, maybe you want to work at Northside, maybe you want to work in a private practice that does family medicine, maybe kids, maybe you like kids and want to work in a pediatric office. So where you are placed, we're going to try very, very hard to match you with the type of environment that you may work in, that you may want to work in, with the hope that if you like it and it's a match, you will stay on. That doesn't mean it always happens. You may do it and say, hey, I know this is not where I want to work. I thought I wanted to work there. In that case, we can still refer you to places that we know are looking for MAs. And the funny story is I just went to my dermatologist today and they had signs up everywhere saying they were looking for medical assistants. And I'm like, I need to talk to the office manager and tell them about this program because it really, as Shannon mentioned, is such an in-demand job. And my dermatologist he was like, I don't have my staff. I don't have people here in the snow and everything else, and I'm hiring. So it really, you really will never hurt. And some MAs get into one field, determine that, hey, this is not the field for me, and they switch to another specialty. But we will kind of walk you through that process. And then as I mentioned, we can't make any guarantees per state guidelines. So we're going to ask you to name your ideal externship, your ideal environment. One funny story also, another funny story is that hospital work, is different from family practice or different from outpatient work. They spend the night at hospitals when there's bad weather or inclement weather. We've had some former employees who went to work for a hospital who had to stay over on snow nights. And they're like, wow, this is different, right? Some of them were just unit MA secretaries. They weren't even working with a provider. But keep that in mind. If you work in a hospital never closes, right? So these are all things that we will help support and mentor you through as you're making that decision about where you ultimately want to be placed. All right. All right, so that brings us to the end of our presentation. I didn't see anything in the chat as far as questions, but certainly we want to open it up now. If there's anything I went over that you want me to go in more detail, or you have questions for Shannon or Evelyn, please feel free to put it in the chat or raise your hand and you can unmute yourself and we can kind of go from there.
Earlier, this was a little earlier before the session started, someone had asked if it was hard to get accepted into the program. I think a lot may have already been answered through the presentation, Shamika, but I don't know if there's anything else that you may want to mention.
Yeah, I mean, admittedly, our first cohorts are going to be small because we have not secured our third building yet. So, Access Academy, what makes this first cohort special is you're part of the first cohort, right? So, we will not be able to accept a large number of folks in the first cohort simply due to size constraints. Now, as we get into the new building, which we hope will be in the next year, the amount of students that we can accept is going to increase. And so, regardless of that, though, we're still going to be selective because I am a big believer of quantity over quality. And it's not going to be, the type of program that has unrealistic expectations, but we do plan to pour ourselves into this and really give you a great experience. And really have you coming out being someone who is very capable of going into a practice. So I guess if you say it's going to be selective, probably a little bit. We want to make sure we're a good fit for each other. But Shannon, do you have anything you want to add?
I would say, is it going to be hard to get in? Yes, probably. But once you're in, you're going to be trained by the best. That's part of our brand. We're known for the people we train and for what we do. So you're going to carry our name out there. So it's not going to be hard if you come in with the right attitude and it's really what you want. But yes, a little bit.
Yeah, it looks like we have two other questions. One, I think, how many people are accepted into the program? I think Shamika may have already kind of mentioned that it's going to be a small cohort.
Yeah, and on another thing too, I just want to make sure this is not just open to Gwinnett residents. So Access Academy is open to anyone throughout the metro area. And so that really is what will make it, I guess, like Shannon mentioned, if you do the work, I mean, and you have the right ideals about why you want to get in, it's really only because we are opening it up to metro area residents. And we are also opening it up to folks who may be maybe not a traditional student, maybe somebody who kind of came in and wants to do a career change, but has all the right attributes of what we're looking for to go into an MA program. We probably will only accept, to be quite honest, 10 to 15 people in that first class. And it will just depend on who actually pays the deposit to come. And then we'll probably have a wait list, and then we'll kind of go down that wait list to see, who else we want to admit. So we'll make sure that we have a general list of those who we can accept, and then an additional list of folks who we can admit should everybody not accept their admission.
Awesome. Another question, what kind of questions can we expect to be asked during the interview?
So I'll give my take on it, and Shannon can kind of pop into, I just really want to know your why. If you have me for an interview, and everybody will have similar questions on the interview. We're going to definitely try to keep it consistent. So, but one of the things we really want to know is your why. Like, why are you applying for the program, and just who you are as an individual person. Really, we know how to train you. We can turn you into. We've had people who were waitresses. We've had people who were fast food workers. We've had people who had zero medical training, and we've turned them into cardiology PAs and rheumatology PAs. And you would never know that they knew nothing when they came. So we are confident in our ability to train. But we look for character. We look for integrity. We look for people who, have that drive to want to just do the best, be the best medical assistant. And if I can think of everybody who has been successful as MAs coming out of Good Sam, it's those folks who really are self-starters, really can have taken ownership of the organization. So much so that when I'm not there and when Shannon's not there, they run the building, and so that's essentially what I think we're looking for. And Shannon, you may have things you want to add.
No, I think that's it. I like to hear the backstories and the why. I think probably sometimes more important because we can teach you the rest.
Mhm. Any other questions? So I don't want to discourage anyone from applying. I think, we're going to start looking at applications, and I believe it's April or May, but, start thinking about your application now. It's on our website. It's available for you to look at. It's very reasonable. It's only like one page. You can certainly attach, additional sheets if you want to kind of expand on your story a little bit, but it's not required. But we will look at all of the applicants together collectively once the application deadline closes.
We got another question in. Someone wants to know, did any students manage to balance this program with their undergraduate courses at the same time?
That's a very good question because this is the first one. I will tell you that that's going to be hard. You would definitely have to work with your school. We have someone on GGC on our board who is very committed to this program, and I'm sure will be a very, very good advocate. I'm not sure if you go to GGC or if you go to another school, whoever's asking the question, but I would definitely say you want to talk to your academic advisor and let them know that this is something that you want to do. Um, you know, we can't, change the times or do anything like that, but we certainly encourage you to talk to the school to see if they'd be willing to work with you. The good news is, it's 16 weeks. I know that that's, a good chunk of time, but the good news is it has an end date, right? And if you can get in and get the training done and, maybe talk to an employer to see if they could do something part-time, or maybe if you want to finish your externship and you don't necessarily need to be placed right away because you still got another semester of school left. That's all stuff we can kind of talk through. But I would say in terms of attendance and attending the labs and stuff, that's going to be mandatory. So I would say talk to your advisor to see if that would be something that they could work with you on.
Yeah, great question. Anyone else? It looks like, okay, someone asked, you mentioned classes are 3 days a week, 9 a.m. to 2 p.m. Are the schedules already decided?
Yeah, so we had to give the state, when we were applying for the certification, all of that had to be predetermined, right? Like they wouldn't let us create a program where we said, okay, we're just gonna, kind of wait and see what everybody can do, and then we're gonna come up with a schedule. So I think we did Monday, Tuesday, and Thursday, I want to say. I don't have
I think it's
the
Monday, Wednesday, Thursday, I think.
Monday, Wednesday, Thursday.
Yeah.
Thank you. And again, we were required by the state to give that information ahead of time so they can hold us accountable to that, right? So everything we present to you guys, we had to first present to them, and they are going to hold us to that standard. So that is when the classes are going to be held. Now, that doesn't mean that in the following cohorts or anything like that, or from time to time, we won't change those days, but that's what the initial cohort is going to be. The Monday, Wednesday, Thursday, 9 to 2, with the labs being 12 to 2, and then the externship being 160 hours. Any other questions? These are good questions.
Another question came in, would you happen to know when deposits are due and how much starting?
Yeah, so the first deposit would be $500, and that would be due in June, right? So I believe we said June 1st, or around June, around the 1st of June, if you are admitted. So if you are, if you apply and you're chosen for an interview and you are admitted, you would attend an orientation where you would be given all of this information in more detail. The information sessions are just meant to kind of give an overview, but certainly I think we said that we need that first deposit 1 month prior, and that just makes sure that you're going to come. And if you do decide not to come, we could give that spot to someone who may be able to come. So we do ask for it a month prior to the start date of the first day of class, which would be July 15th.
Someone asked, when will these classes take place? And I think you may have already touched on that, Shamika, but I don't know if there's anything else. And
Sure.
maybe location, like where will they be?
So so I know we are doing this virtually, but I highly recommend, and we'll get to this on the next slide. I highly recommend that you come and do an in-person tour at your convenience, because that's where our classes, until we get our new building, all of our classes, thank you, Evelyn, all of our classes are going to be held at our East location. I don't think we have the address on here. But we do have the phone number on here. So you can call that number. That's our East Clinic. It's located on Commercial Court at the corner of Jimmy Carter and Rock Bridge. And then there's also a contact us. And it's really good if you call ahead of time to get something scheduled. That way, Shannon or the assistant practice manager, Jessica, can walk you through the building, show you where the classroom is, show you where you would be doing your lab work. We do in-person, or we're considering keeping to doing in-person, virtual in-person information sessions as well. But if you can only make a virtual session when your time allows, we highly recommend that you go. Make sure the location is good for you, make sure you can get there by, start of class. Make sure that's not too far from your house, like all those things that you would need to consider prior to starting, a program.
I just dropped the location, the address of our East location where the classes will be held in the chat. So
perfect. Thank you, Evelyn.
Yeah.
Yep. The classes are going to be so we're going to do 2 cohorts a year. Right. So the first cohort is going to start. So if this was a normal year, right, if we weren't on our introductory class, we'd have one start in January and one start in July. So there are going to be 2 cohorts every year. And each cohort is going to have initially so many people admitted. So I mentioned the 10 to 15 number. And then when we get into our new building, again, that number could increase. It depends on the size and the space. We are looking to significantly increase that once that new space is ready for us. So 2 opportunities to go. If July is not a good fit, then it's a rolling thing, right? We'll do another one in January of 2026. So if you're in school and you say, okay, well, I got one more semester, I may want to wait to do the program, once I get out of school, then just know we're going to do two per year from now on. So there is opportunity, if one cohort does not work for you, to look at doing the following one. And just a heads up too, as we kind of get this under our belt, we are going to eventually add dental assisting to Access Academy, and we have additional ideas for more programs that we want to add to our coursework. So that is currently something that we are looking at as well, that more to come on that. The link at the screen, if you go to goodsamgwinnett.org, there is an Access Academy heading on that website, and there is a link to the application on our Good Sam website.
I'll go ahead and drop that link in the chat as well.
Thank you.
That's the link that will take you to the Access Academy webpage, and then you just scroll down and you'll find the application and catalog and all the other great information that Shannon and Shamika shared, including future dates for future virtual sessions and information sessions, in case you still trying to figure it out and want to join another one. Anyone else have any other questions?
All right. Well, it looks like there are no more questions. So we definitely want you guys to follow us on social media. Evelyn does a wonderful job in keeping all of our platforms. I feel like it's growing by the day. We're on LinkedIn, Instagram, Facebook, and WhatsApp. So please take a moment to scan the QR code so you can keep up with what's going on at Good Sam. So Access Academy is just one of the things we do. We are so active and involved in so many different things in our community. We do lunch and learns, we do tours for people at our clinics, and very, very active in the community. So we'd love for you to follow us on one of our platforms or all of them if you're on all of them, and just keep up with what we're doing to serve.
Yeah, it looks like someone had another question came in. Do we have to be done with our undergraduate course to be able to apply?
No, absolutely not. So you do not have to be done with your undergraduate courses. Some people who do this program might not be in college at all, to tell you the truth. They may not feel like college is for them, or they may need to take a break between, doing something, maybe working before they go to school. So we have no requirements that you have to have any college training prior to doing this. So we have trained medical assistants who have not had any college training, like literally no biology, no science, no nothing. And they have become great medical assistants. I mean, wonderful assistants. So the answer is no. You do not have to have any college coursework or be done with your college coursework to apply.